I want to welcome everyone this evening to this special presentation, this special panel presentation that's sponsored by the WDMS Student Committee. This is a new committee for WDMS, and it's one that I have the very great privilege of co-chairing. Although to say I co-chair it really is an overstatement, because the students that are involved in this committee are extremely committed, engaged, and really do not need any sort of assistance from me. And I think that you'll see that tonight with the program that they've put together. So to introduce myself, I'm Ann Larkin. I am the Senior Associate Dean and Vice Provost at the University of Massachusetts Medical School, and very, very interested, obviously, in organized medicine, one of my great commitments in my career. So I was very happy to partner with Bennett and Calvin on this project for WDMS. I want to point out that the goals of this committee are really to bring people together. Bennett exchanged an email with me just last week that really very nicely put the goal of forging connections with each other, which is especially important in these very difficult times, which I believe that we're on the brink of coming out of. We can forge connections with each other. We forge connections with obviously with the Worcester District Medical Society, and perhaps most importantly, we forge connections with the Worcester community, where we all work and live and engage in so many activities. So with that, welcome. And I would like to turn it over to Bennett Vogt for introductions. And I hope you enjoy the program this evening. Thank you.
Thank you so much for the very generous intro, Dr. Larkin. And as you said, the purpose of this committee is to bring us as the students closer with the community of physicians in our area through the District Medical Society. I'd like to start just before I introduce our panelists to talk a little bit about how we're going to be running the event tonight. So first I'll introduce all the panelists, and then we're going to be going directly into breakout rooms. Each of you has been randomly assigned to a breakout room with one of our panelists, where we'll have the opportunity to ask questions directly and have a close conversation about the issues facing our community and vaccinations in particular right now. And then we'll have the breakout room leaders, the panelists, will swap halfway through, and you'll have the opportunity to have another conversation. And then we'll come back together at the end in order to share some of what we've learned and have an opportunity for the panelists to all discuss. So this might feel like a little bit of a different style than some of the Zoom presentations that you might have been on before, but it's in an effort to really have that close interaction and conversation. So with that, I'd like to introduce our panelists. Dr. George Abraham is Chief of Medicine at St. Vincent Hospital, Professor of Medicine at UMass Medical School, and Adjunct Professor at the Massachusetts College of Pharmacy and Health Sciences. He earned his medical degree from the Christian Medical College, Ludhiana, India, completed his residency and chief residency at St. Vincent Hospital, and received his master's degree in public health from the Johns Hopkins Bloomberg School of Public Health. He is a board certified internal medicine and also in infectious disease. Dr. Abraham is the Emeritus Chair of the Board of Governors and a Regent of the American College of Physicians. He is currently the President-elect, and later this year will become the President of the American College of Physicians. Dr. Abraham is also the chair of the Infectious Disease Board of the American Board of Internal Medicine. Among the many, many roles in which Dr. Abraham serves, he is chair of the Board of Registration, Licensing, and Medicine in Massachusetts. He has served as a trustee for the Massachusetts Medical Society and is a past president of the Worcester District Medical Society. Dr. Abraham has received multiple awards for teaching, and his research interests include hepatitis C and B disease, travel medicine and infection control, as well as medication safety and systems improvement. He has authored over 100 publications, abstracts, and book chapters, and is an invited speaker at national and international meetings. Next, Dr. Mathilde Steele. Dr. Mattie Castile is a general internist and commissioner of health and human services for Worcester. She brings a wealth of professional knowledge and more than 3 decades of experience to the role. In addition to strong community-based leadership in the fight against drug addiction and homelessness, she is a board certified in internal medicine and has been medical director of a large municipal EMS system, an ER attending physician, primary care physician, urgent care physician, and physician to an elderly outreach program. She received her MD from the University of California, San Francisco, and came to Massachusetts for internal medicine at UMass Memorial. As an administrator and a physician, Dr. Castile has been at the forefront of the community battle against homelessness and drug addiction. She is the founder, executive director, and medical director of the Latin American Health Alliance, a collaboration of diverse community groups dedicated to combating homelessness and drug addiction. She is also the founder of the Hector Reyes House and Casa Reyes, a substance abuse treatment facility and transitional housing for Hispanic males in Worcester. Last year, many years ago, Dr. Castile opened Cafe Reyes, an innovative jobs training program in which residents at Hector Reyes House and Casa Reyes run the Shrewsbury Street restaurant. Next, Dr. Jim Leadwith. Dr. Jim Leadwith is a family physician and assistant professor at UMass Medical School, having been a member of the UMass Medical School faculty since 2005. He is a graduate of the College of William and Mary and the Virginia Commonwealth University School of Medicine. After residency in Toledo, Ohio, he served the rural Virginia community of Tappahannock for 19 years, where the Ledwith Lewis Free Clinic now bears his name. He assumed leadership of the UMass Fitchburg Family Medicine residency from 2008 to 2016 and continues to teach in the program while serving as learning community mentor within the medical school and practicing in the Benedict Family and Community Medicine Center. Dr. Ledwith has a commitment to service throughout his career. He volunteers as medical director for the free care program at Outworth United Methodist Church and the UMass Medical School, and as a UMass Medical School faculty advisor for the student organization, the Worcester Free Care Collaborative, leading students in delivering care for vulnerable, uninsured, and underinsured individuals from Worcester and beyond. He also serves as faculty advisor for the UMass Medical School Crisis and Emergency Preparedness Committee, which coordinates the medical student response to the COVID pandemic and other public health problems. Finally, Dr. Beverly Nazarian is a pediatric primary care physician and associate professor of pediatrics at UMass Medical School. She completed her medical education at the University of Minnesota School of Medicine and her pediatric residency at Children's Hospital. Dr. Nazarian's interests include advocacy, medical education, and children with special healthcare needs and school health. At the medical school, in addition to being a fantastic and well-regarded preceptor, she has helped to educate students in the care of children with disabilities, the physician's role in advocating for children and families, and the importance of physician collaboration with community partners. She is the school physician consultant for the Worcester Public Schools and has led an interdisciplinary school reentry pediatrician advisory group for the Worcester Public Schools throughout the COVID-19 pandemic. So I hope that you can see that we've brought together a group with a wide variety of perspectives and a tremendous base of experience in addressing the needs of the community. And with that, Calvin, if we're ready, we will start the breakout rooms. You should see a message to join your respective breakout room now. Each of the student leaders from the rooms will share just a brief, no more than 1 minute summary of what they've talked about. And then we'll have an opportunity for the panel to discuss together. If there's any questions from the audience, since we're in a relatively large group, I'll just ask that you use the raise hand feature reaction so that we know to call on you to ask and get your question answered. But to start out with, so I was running around the rooms with Dr. Castile, and we talked about a number of different issues, including the challenges that the city faces with only having 800 vaccine doses per week that they get to administer as the equity doses, and how even with that challenge, there's a lot of work that's really being done to go door to door, to reach out to communities, and even vaccinate up to 60% of the Worcester Housing Authority, which is really impressive and contributes to vaccinating a really diverse population that wouldn't be reached otherwise. And yeah, we have a lot of lessons discussed for the future of medicine. So I will turn it over to Paramesh to talk about what was discussed with his group.
Hi, everyone. So I was tagging along with Dr. Ledwith, and really the kind of the common theme in our discussion was the issue of vaccine hesitancy. And both Dr. Ledwith as well as some other like professionals who were in the groups with us, they talked about some strategies that they found helpful. And, you know, a lot of it was really kind of, I'm paraphrasing here, but like putting your money where your mouth is, and telling people that, you know, the professionals themselves, they all got their doses as soon as they could. And I mean, acknowledging the fact that some people are just going to be hesitant and aren't going to be dissuaded from, you know, alternative facts, etc. But really a lot of people are just kind of afraid. We also talked about the challenges we're facing going forward and kind of the future of this disease in the US, and how really the main challenge that we're facing is kind of logistics, in that, you know, as Bennett mentioned earlier, we simply do not have enough doses right now to vaccinate everyone who wants a dose. But, you know, when Massachusetts gets more of the Johnson & Johnson and possibly AstraZeneca formulations in the future, that could change for the better, as those are just single dose vaccines.
Excellent. Iha, what did you discuss?
We had a wonderful multitude of discussions with Dr. Abraham and many of the other people attending. We're all experts. I think one of the really interesting conversations that also came up was the hesitancy. We talked about the African coalition in Worcester that with specific leaders being used to help motivate patients and motivate community members towards like actually getting the vaccine and help allay some kind of fears. We also talked about some of the barriers for undocumented populations in getting the vaccine. I thought a really wonderful conversation we also talked about was the value between getting max vaccinations and the loss of kind of the individual physician relationship and trust to get other people vaccinated. I thought that was really wonderful. So talking about how in West Virginia there was really high vaccination rates, and they were all focused very locally focused in community health centers with individual physicians facilitating that, or individual providers. And then another topic that was kind of interesting too was the getting more physician volunteers and getting more people to volunteer for the vaccine efforts, and how we can kind of eliminate barriers to that. So those were a couple things. Another great point that was brought up by one of the students was making the COVID vaccine mandatory, like the way we make the flu vaccine, and what the barriers to that are. So we talked about how once the FDA sort of approves that and takes steps for that, we might have a more, more required COVID vaccination. So all around really great, interesting, diverse scope of questions that went through.
Fantastic. And Sarah?
Yeah, so we also had a lot of different discussions. I was partnered with Dr. Nazarian, who had the unique perspective of being one of the pediatricians here, also a physician. So we talked a lot about vaccine hesitancy with parents and different vaccines aside from the COVID vaccine, such as the hepatitis vaccine and the HPV vaccine, and how best to address vaccine hesitancy in those populations. And then in our second group, we talked more about the COVID vaccine and kind of barriers to getting it into maybe primary care offices and different ways that the COVID vaccine could be distributed to get more patients vaccinated. as well as the role that media plays in patients' views on vaccines. So I think we covered a lot of topics in our 2 rooms.
Definitely. Well, I would like to turn it back to the panelists a little bit, just to hear about what it is that you think that you've learned or are interested in hearing about from each other as well.
Go, George.
Oh no. Well, I missed chatting with Mattie, but that's always interesting. You learn something new. But I think that the value of just interacting wonderful students and great conversation, and we were blessed to have several physicians in both our groups, both who've had diverse perspective as well, and so they added richness to the conversation. So I think this was a wonderful exercise, and it keeps us all informed about what the challenges are, and probably gives us new ideas in how to approach it in order to improve our vaccination rates. What we call the arms race. How many arms can we get a shot into?
I like that, and I agree, and I think that I guess what I'm looking forward to is that all the med students are the ones who are going to take the lead now, and they're going to change the system, and we're going to not have any inequities in healthcare, and we're not going to have divides in our community, and we're going to really fix the social determinants of health, and we're going to start looking at it as what we say, that we're going to start figuring out how we start providing housing or advocating for housing and jobs for people and fair wages for people and safe places for people to walk and access to food and all of that we say is what determines health. Then we need to change our system and make sure that those things are a priority in our community so that we do build a healthy community. I want to say that one of the things that was interesting is that I didn't even think about when we were vaccinating, and it said 75 and then 65 and above. And when you looked at communities of color, certainly those weren't the people that were affected. It was certainly the middle ages, from 39 to 59 were the group of people that were affected. And when we were talking about it, and we went to our first clinic, which was at Rock of Salvation, and we didn't get anybody. And that's when people said, well, our people don't live that long. And so we don't have those people. And so we need to change, how we start looking and not looking at our age group. And then when you look at the different neighborhoods and you look at the, what's it called, the age when people are dying. And ours, you can tell the difference from the west side to Maine South. And those are the things that I look forward to having you guys change that. And that rate should be the same for every community. And that those health issues are figured out, and that we change those inequities. So, Mina, Ben, all of you guys, I'm looking for you guys to do it. So, let me know.
We've got our work cut out for us.
Yes, we did.
What do you think about us facing a required COVID vaccination, though, Dr. Castile? I actually heard of an employer that's already requiring it of its employees, so it could come to us. UMass did not do it yet, but who knows? Yeah. Maybe next season we will.
It's going to be a tough one to do. I think private employers can actually do that. I think the hospital doesn't even require for the flu vaccine, so they're not going to require it, and they're going to say you're going to walk around with a mask the entire time. It's not required here in the city, but I think in time, there becomes a process where people feel shamed that they didn't get the vaccine and everybody else does, because it's who you're going to hang around with and who you're not going to hang around with. So what I think about is places like Israel who has the card, and that you can't go to this show or you can't do this thing unless you bring your vaccinated card, that you've been vaccinated. So those are interesting thought process. So I actually tell the patients that we vaccinate, don't lose that card, because we may need it to go see a movie, or we may need it for something. Certainly for travel, we may need it. So I don't know. We're going to have some discussions on that pretty soon, I think, with the chamber, and seeing what the thought process is in that.
I'm hoping that we can move towards maybe having like a digital fingerprint version of the card or something to be able to carry around. But Dr. Nazarian, what are some of your takeaways as well?
Well, first of all, I also want to echo how lovely it is to be able to, have our students here, and you guys are so inspiring. And I personally, as the pediatrician in the group, love being able to learn from my adult colleagues, since my patients, as I pointed out in my sessions, are for the most part not yet eligible for the vaccine, although their parents are very interested. But I think, as I said, as pediatricians, we know how it works when you require vaccines. It's what we do all day long. And I think that there will definitely be challenges to that. I think even with, mandating the flu vaccine this year, it got a lot of people to do it, but it also got a lot of my families who usually do it to say, how come they're forcing me to do this? So we live in a place where people are not really good about being told what to do. So it will be interesting. But I don't know. But I think this has been, a great event to have overall. And I think, I guess what I would like to learn is I would really love to know what I missed out on was hearing from our other panelists about the things that they're doing, which I would love to learn about.
Well, from my perspective, what I'm doing is really trying to keep up with these medical students and what they're doing with staffing the vaccine corps and the Crisis and Emergency Preparedness Committee. They're doing an awesome job, and it's just an amazing event. My busy work schedules allowed me to just get to one vaccine event so far, and it really is just remarkable to see the real joy in people who are able to finally get vaccinated and reduce that angst about either their own health or will I bring an illness to my 90-year-old parent or family member who I also need to be a caregiver for. Very often that's the area of concern. It's making a difference, and so many of you who are on this call, I think, must be volunteers in that effort, and it's wonderful. And we're not going to stop it. And I'm looking forward to a time I can actually schedule a day off from my own clinical duties, and I can actually say, okay, now I can get in and do another vaccine clinic. But get some more vaccine into town, Dr. Castile.
I will try. But I have to tell you, I've had the privilege to work with the med students, and it really has been an experience. Now, I don't get to that often. I only do a population clerkship, and I get to work with them there. But to have them come on a daily basis and get to meet the community, and also the pleasure that they get doing this has been a great experience. And what the med school has done, providing this vaccine corps, as they call themselves, is incredible. It's an asset to our community. They run they also run the Worcester State site. They do mobile vaccinations. They come with us mobily, and I think they're spread out throughout Massachusetts. So that's an incredible thing that is doing, and it's a model really for the country that again, I go back to saying we don't need those contractors to do it. We have our own community with med students and all of us to be able to vaccinate our own people. And so I'm thrilled to be with them. And Mina is my person who comes all the time with us and does our scheduling and all our clinics. So he's fantastic.
I don't know where we all would be without Mina this year.
Without Mina this year, absolutely.
I second that.
Well, I'm glad Dr. Larkin's not on the call anymore, I don't think, because, I've actually made comments from colleagues who have worked in Cuba before that last winter they closed their medical schools and sent their medical school students out to be community health workers to basically do tracking of every reported case of COVID and assure they were quarantining properly. And even with the lack of great resources in that community, they were able to contain that epidemic on that island in a way that we could only pray for. We would like to get our cases down that low. glad we didn't have to do that with our students, but
Right.
I think we're grateful for the opportunity to serve while also continuing our education simultaneously.
Betcha.
Dr. Abraham, I don't want to put you on the spot, but I also want to have an opportunity for you to answer Dr. Nazarian's question as to what you've been up to and what St. Vincent has been contributing as well to this effort. I'm sorry, your microphone's muted.
My apologies. So as Dr. Castile alluded to, the Worcester State site is overseen by us. So it's a nice collaboration between Worcester State University, the City of Worcester, Department of Public Health, headed by Dr. Castile, Commonwealth Medicine from the med school, and us. So we are the clinical partners. So we oversee, we do almost about 1,000. Now we're about 700 plus doses a day. We're trying to hit 1,000 a day, and then once we have returning folks, probably be 2,000. But it's a wonderful partnership we've been able to harness. Obviously, med students are residents. We have MCPHS students. We have Worcester State students. So wonderful partnership between all the different people. So it's a great experience. So far, we've had some uniform kudos, I think, just because of the wonderful people who work and volunteer there every day. But it's a fulfilling experience. So I agree, everyone who gets a chance to do some of these, it's a different reward and a different experience, and definitely is something which will remind us why we went into the profession.
And kudos to our students and the great response you've given, because the word got out. The CEPC was asked about coming out to the East Boston Neighborhood Health Center to help vaccinate there. And we said, well, aren't there medical students in that Boston community somewhere? I think there's a medical school in Boston somewhere that they might recruit help. So actually our students have done training of Boston University students, and basically we did a train the trainer type of thing, and they took part in training BU students to vaccinate, and now they are staffing vaccine core sites throughout the greater Boston area. Kudos to our team that we're able to put all of that together. The word got out about your great work, and it's spreading.
Now we're starting to export our efforts.
There you go. You can't do it all, so train other people to help you do it.
Yeah. Well, just in our last 10 minutes here, I want to open it up to the other folks who are in the audience here. If you want to raise a hand, or there's a few of us you can probably unmute as well, if that's easier, just to ask a question of our panelists. Maybe, you were in 2 of the breakout rooms, you didn't get to talk to someone else.
So somebody asked me, and I'm trying to remember who it was, how would I handle, what would I do differently during this pandemic? How would I have handled it? And I'm going to send that one to Dr. Abraham.
They say hindsight is 20/20.
Yeah,
So
well, we got a year behind us. What would you have done differently?
Well, like obviously the public health measures work to some extent in our setting. If we looked at it, the biggest challenges I was sharing with one of the groups that we were speaking with. There's a great article in the New York Times looking at press coverage of COVID-19 and the vaccine rollout, and somebody's done a formal analysis to show that the press has been so negative about everything, and so when COVID numbers started improving, they started focusing on areas where COVID numbers continue to stay the same or were increasing. In other words, people really going fishing for bad news rather than good news. So the whole rollout and the way, one of the reasons why we are in the position we are in compared to other countries in the world who were ahead of us. So if you look at the international timelines of vaccination, we are only number 5. So even the UK is ahead of us, Israel is ahead of us. And so the question is, why did countries get ahead of us? Because there's been so much negative publicity that it's been, and the challenges of rollout have been. So if there was one thing we could do different was rethink the way we rolled out our vaccines and really look at lots of missed opportunities there probably in the way we rolled it out would be number 1. Number 2, as I was sharing with our group, We look at the flu data. The flu activity this year was virtually non-existent. And we sort of knew that early in the year from last summer when the Southern Hemisphere who get their flu didn't get their flu. So you could make the argument that instead of flu vaccine next year, all you need to do is wear a mask, because really masking made the difference and not the flu vaccine. And knowing our history of flu vaccine, if efficacy being 40 to 45% at best on any given year. So there are several different things we've learned. One, I think pandemic preparedness was really low on our radar. We've now bumped that up. The ability to roll out vaccine when it was developed to harness technology. I think the only good thing that happened out of this was there was uniform sharing of information right from the beginning. So some folks who are a little older on this audience will remember the first SARS epidemic in 2003, 2004, where at that time, everybody was safeguarding their data. Nobody shared anything. This time, the first thing they did was the whole genome was sequenced. It was out in the World Wide Web. People could use it to their own. Every single article on COVID-19 from every single journal is open access. So sharing of information led to quickly developing technology. Our problem was we couldn't roll it out fast enough because we couldn't eliminate roadblocks and we couldn't convince our people. So we couldn't get out of our own way to do that. And probably masking has made a significant difference. I think I'm curious to hear others' opinions about it. But I think there's lots of lessons we've learned. The other thing is we've learned to harness Zoom technology.
Well said, George. I truly agree with everything you said. I agree. I do like that whole thing, that collaboration across the world it's something that's never happened here, at least during my lifetime that I've ever seen that. And I mentioned in one of the groups that I also look forward to that collaboration happening continue to happen in Worcester, that St. V's, that UMass, that all these places become one, that we work together and not that they're different entities, and that would be great. And I think we did it, and we've done some of that. I would like to grow that. That would be a great piece.
Completely agree. I apologize for my internet. I think didn't support me in between. Apologies for that.
It's wonderful that we have a supply of vaccines to give to our most vulnerable patients, but it isn't enough yet in Worcester. And we have to reflect that while the United States is looking for more and more vaccine to protect our population, every 100,000 doses we take in the USA is 100,000 that may not go to a developing country and other vulnerable populations across the world. We have to be aware of that and how fairness in protecting our population should be an international enterprise.
And that is fair criticism. That is actually correct. So Jim's correct on that, because already there are parts of the world who can't afford the cost that it is to get this vaccine. Well, we as an affluent country have been able to provide more. And so that was the criticism with AstraZeneca, that we weren't using it and we were just hoarding it. We weren't sharing it. And so therefore, that's why the administration suddenly started giving vaccine to Mexico and Canada, because I don't think there's any immediate plans to use it. And so at least not hoard it, but to share with others. That's correct.
My understanding. Go ahead.
Sorry, with that said, George, so if people are getting the first dose of a 2-dose vaccine, like the homeless population, and they're not then following through, what happens with that second dose? And is that being used? And where is it best being used so that it doesn't go to waste?
Yeah, the dose. So in my knowledge, I don't think doses are being wasted. I think doses are still being used. There's always an emergency list that's created for folks who can come at short notice and get a dose. You're correct. The second dose is a challenge. But I think there's increasing data to support that even if the delay from 4 weeks to even 6 weeks or 8 weeks or so on wouldn't be a fatal flaw, so to speak. And so they could still get a second dose. In fact, there's 4 studies published in literature in people who've had COVID that they may only need 1 dose because the immune response is so robust that they may not need a second dose, but that's still being validated before that becomes a norm.
Right.
So I think lots of changes that are happening. But yes, I agree. The 2 doses are a challenge from that standpoint. Till June, I don't think we will see a change in that because Johnson & Johnson alone can't ramp up enough. See, unlike the other 2 who had already pre-prepared vaccine because they were confident in their results, Johnson & Johnson till the end were not confident. So they manufactured very little, wanting to go only after they got approval. And so now they're ramping up, and so which is the challenge to why they can't produce enough.
Because those people that are getting that second dose, which is really their first, are they then ensured that there's going to be enough for them to get their second dose, right? So
yeah, there is enough vaccine. So what's also being looked at is whether interchangeability of the vaccine. So somebody got a Pfizer first dose, can they get a Moderna second dose, or vice versa? Given the technology is the same, so that's being looked at right now.
Right, and the efficacy on that. So
the efficacy is comparable, and the technology is pretty much comparable. The dosing difference, there's a difference in dosing with Pfizer being only 0.3 ml and Moderna being a 0.5 ml dose. And so I think they're looking at the equipotency of one versus the other if they were to be interchanged.
Want to be respectful of everyone's time, but there's an important question in the chat. Kimberly asked about where the vaccination effort currently lies with incarcerated individuals. And I was wondering, Dr. Castile, since, with the population health clerkship, had a chance to visit the county facility, if you have any perspective on that.
So interestingly enough, we wanted to do a town hall with the people in the jails, and they didn't allow that, so that we would be able to talk to them. They were, I think it was phase 1, step 2 or 3, something like that. And so they got their vaccines, and the people in the officers and the sheriff and everybody else was able to went over there and started talking to the folks that were there about getting the vaccine. And I think all of you can sort of get the feeling of how many people would actually get the vaccine if they're not talking to people who know about the vaccine. So only 50% of the prisoners were got the vaccine. And now he's asking what else can I do? And I said, again, what we offered, which was let us talk to the people. Let us bring the docs. Let us bring the people who know about the vaccine to talk to them so that they can understand. And again, it's such a process that I can't describe the jails, but they have their method. We have our method. I'm trying to get them to open up a little bit and be able to understand. We have those issues with providing, medical care for addiction, be able to provide Suboxone and all these different things. Well, it goes for everything else that happens. And so we continue to work together to figure out how we can change that, but it's another work in progress.
Well said.
I have one question. I have one question. There was a bunch of chats about Krispy Kreme there. What was going on there? I want some of those donuts. What was happening?
There aren't any in Massachusetts, I think.
You have to drive an hour to get to it.
Yeah, you won't need the lipid nanoparticle anymore. You'll need the lipid macroparticle instead.
If you can prove you've been vaccinated, they'll give you a donut a day. That's what it was.
I raised my older kids on Krispy Kremes in the original store in the west side of Richmond, Virginia.
Wow.
Yeah. That was the big weekend event when we could get into the city and do that.
Cool. So maybe in life, next time when we do this, Martha, you can bring some Krispy Kreme so that we could enjoy the process. Not that we did, but a Krispy Kreme would add a little more to it.
Figure out how to do that virtually, but I'll work on that, Mattie. Thank you.
You may not have seen the news piece, but Krispy Kreme is offering a free donut to anyone who can show that they've been vaccinated against the COVID vaccine.
Oh, right. That's what it's about.
And you can get one a day for the whole year.
Yeah.
So 60 miles every day. I think one of the other things that many people in the public who weren't really paying attention to the great stress on folks who lack access to healthcare is their stress about, can I get a test to find out if I have COVID, or can I get a vaccine? And realizing what it's like not to have access may help open eyes to the severity of the problem for those who lack access to a physician. My dream would be that our free care programs would be completely unnecessary because our offices are open to the entire population, but that's just not going to be a reality here for some time to come, unfortunately.
That's another topic the med students can work on that should not happen.
Indeed, as I said earlier, I feel like we have our work cut out for us. But in closing, on behalf of the WDMS Special Student Committee, I really want to thank everyone for coming this evening. I really want to thank our panelists for donating their time. This is a new committee. This is a new education event format that we've assembled. So any feedback that you have on it, we welcome and we encourage. And if people enjoy this, we want to do more things like it on other subjects in the future. So thank you, everyone.
Nice.
Thank you.
Thank you.
Thank you all.
Thank you.
Thanks
Bye-bye.
for